Michigan is well ahead of the curve in its creation of a statewide health information network, which will allow health information data to securely follow a patient wherever they go. To better understand the sharing of protected health information, let's follow the flow of health data through the network from beginning to end. The process starts when a patient visits a healthcare provider's office or hospital. The patient health information is entered into the provider's electronic health record, or EHR. The provider can then share information with a patient via a patient portal and with the Health Information Exchange, or a substate HIE, of which they are a member. The substate HIE passes health data through the Michigan Health Information Network, or MyHIN. MyHIN serves as the center of Michigan's statewide health information network and is helping to create standards, services, and legal agreements ensuring safe data transmittal. From there, the health data is sent to other substate HIEs and is available to providers, the National eHealth Exchange, payer organizations such as health insurance companies, and the Michigan Department of Community Health Data Hub. The MDCH Data Hub shares the information, when appropriate, with public health data systems such as Medicaid and the Michigan Care Improvement Registry, or MICR. Now, let's take a closer look at how health information sharing actually works. We will look at 4 examples: health information sharing between providers and patients, health information sharing between providers and substate HIEs, health information sharing with providers and payers, and finally, health information sharing with Michigan Public Health Systems over Michigan's statewide health information network. Let's begin by looking at health information sharing between provider and patient. In this particular case, the patient was seen in a hospital ER and was referred to his primary care physician. During the patient's visit, the provider entered the patient's data into their EHR. After the visit, the patient can access his or her information through the internet using their provider's patient portal.
Knowing that I've got a direct line of communication to my doctor, to my primary care provider, really puts me more in tune with what's been discussed, at the appointment, at the time of care, and really creates that connection. It puts more ownership on the patient, I believe, and it's really impacted me in a way to cause me to engage more in my care.
Between patients, when I'm waiting for a phone call, when the nurses have something they're doing, it gives me a chance to respond to that thing almost in real time in some cases. That's neat. It's not obtrusive, it's actually just empowering. I think there's a safety factor there that's not present in the traditional system of just having paper charts. I think Michigan has a great architecture. I think what we've put out leads the country. I think there's several areas in the U.S. that are actually in a similar situation of moving the agenda, but Michigan has a good handle on this.
Now, let's look at health information sharing between providers and substate HIEs. Michigan has multiple health information exchanges that cover the state geographically and offer various services to their constituencies, which are made up of individual providers, hospitals, and other health systems. A provider organization can join one or more substate HIEs depending on its needs and sphere of influence. While the substate HIEs work together to share and protect patient data, they also compete with one another, which ensures high-quality service for members.
What we've done is really concentrate on connecting physicians and connecting practices and then aggregating that information into a community record that can be that becomes the foundation for this large network of physicians to share information.
Next, let's take a look at health information sharing with providers and payers. Patients transition from one provider or healthcare setting to another as the patient's healthcare needs require. These transitions trigger EHRs to generate admit, discharge, transfer messages that identify the patient along with important details that provide insight to an extremely complex set of care decisions being made by care teams, families, and the patient. When a patient visits a healthcare setting, the hospital sends an admission, discharge, transfer, or ADT message to the patient's providers to inform them the patient has been admitted, discharged, or transferred. The message goes from the patient's healthcare setting to the substate HIE, for which they are a member of. The substate HIE passes the message through MyHIN, which is then sent to all of the patient's providers via their substate HIE. The providers can then determine the necessary action to coordinate effective care to the patient. The ADT message is also sent to the patient's health plan. The health plan can use the information to help reduce treatment costs. And finally, let's take a look at health information sharing between providers and the Michigan Public Health System, specifically MICR. In this case, the patient visits his physician to receive his vaccinations. This data is shared with the provider's substate HIE that transmits the data through MyHIN to the Michigan Department of Community Health Data Hub. MDCH then shares the information with MICR, the public health information system that collects vaccination information. From there, MICR makes the data available to other entities interested in vaccination information, such as school systems and healthcare providers. The great news is that this entire flow of data is operational today.
Over the years, we've been laboriously hand-entering data into MICR, not only putting it into the patient record, but the staff also had to double chart it and then go into MICR and chart it in MICR. And now that data goes in real time. We are able to access this data in MICR regardless of where they came from, as long as that data was entered into MICR by another practice in the state of Michigan. So it is a very, very advantageous thing to be able to have a registry such as MICR to help us in our daily care.
In the very near future, all Michigan providers will be able to move patient data to and from every substate HIE via MyHIN. MyHIN will also provide access to other providers, public health entities, payers, and other organizations engaged in the health and well-being of Michigan's residents. When this process is complete, our health information will follow us wherever we go.